I love it that you're just addressing the elephant in the room right on, right? And I think with my Oshi hat and with my private practice hat, I've thought deeply about it. And I truly think first, there is a there's a scarcity of gastroenterologists right now. I'm looking at the data, and by 2025, we're going to be short of 1,500 gastroenterologists. And if we keep getting on top of our screening colonoscopies, the number of patients who need access is going to grow while the number of gastroenterologists is shrinking. Praveen, you've talked about burnout, right? There's a high percentage of burnout. About 55% of the gastroenterologists are over the age of 55. So the working population of GIs is shrinking. So I think where we should focus on is where can we deliver the most value? We get in the patients who need the colonoscopies. We get in the pancreatic cancer patients who's waiting in line because 10 functional dyspeptic patients won't get off the phone call because they need to be seen and they're driven by anxiety. And I think that's where this hybrid role comes in, where Oshi can take this time burden off our plates, right? They can take these patients who have high requirements. They need to see RD, BH, they need phone calls. And Oshi is perfect design for them. And while our dockets open up for patients who have a positive fit test and family history of colon cancer, and they're waiting 6 months to get a colonoscopy. So I truly feel that this hybrid model is going to coexist in the future. And it truly is the only way to deliver care. If there's a patient who doesn't have a GI for 100 miles, honestly, the only way he will make it to your office if he sees an NP at Oshi who says, hey, let's go get your colonoscopy. So I think we are going to be very cohesive in the future. And honestly, as Oshi scales, the number of patients we see scales, and it also is going to funnel more patients and procedures to the offices. It's going to extend the reach of a brick and mortar office because of Oshi's reach.